The pathogen currently turning the world upside down is called a novel coronavirus because it is literally new, novel. Humans have never encountered it before. We have no immunity to it. And that is why it's so serious, is why it's been able to ravage the planet. But the human body is amazing, right? When we are exposed to a virus like COVID-19, we create something called antibodies to help fight it off. And that builds immunity against the virus. And those antibodies, they stick around for a long time in the blood plasma of people who are able to recover. Once a person has the antibodies, they may actually be able to donate their plasma to help others as treatment for people who are still sick, or as the basis, perhaps, for a vaccine. For more on how antibodies can help fight this, I want to bring in Dr. Peter Hotez, professor and dean of the National School of Tropical Medicine at Baylor College of Medicine, co-director of the Texas Children's Hospital Center for Vaccine Development. So let's just begin with the basics here, doctor, about antibodies and immunity. It seems there were some reporting early on, 1 or 2 cases in Hong Kong, maybe people getting infected twice. But it seems from what I've read, the bulk of evidence suggests people get it once, they build up the antibodies and are then essentially immune. Is that correct?
That's right. And there's precedent for that with other human respiratory virus infections. What happens is after you're infected with the SARS-2 virus, which is the other name for the virus agent of COVID-19, you develop an antibody response around 10 to 14 days after infection. That doesn't necessarily mean you're immune, but there's now been studies in rhesus macaques done in China, non-human primates, showing that they develop similar antibody responses and the scientists are unable to reinfect them with the virus. So there's indirect evidence that that indeed does confer immunity. The question is going to be, how long does it last? And there's some evidence from the previous SARS, so this one is SARS-2, the previous SARS back in 2003, that neutralizing antibodies, we call it, can last at least 2 years, possibly even much longer.
So if people have antibodies, so from a sort of epidemiological perspective, Mark Lipsitch was talking about one of the great unknown questions, right, is what percentage of the population is getting this and being totally subclinical and totally asymptomatic or very, very mild, which means how many people are out there with the antibodies? I've seen reporting that several different enterprises are attempting an antibody test that would essentially test people. How would that work?
Well, and we have a lot of precedent for that, for measuring antibodies to lots of different infectious agents, and it's an indication of past exposure. So what we say is if we know the percentage of the community that's been exposed to this virus and has antibodies, that we call that the seroprevalence, the percentage of people that have been infected and exposed to the virus, and therefore we know how much transmission there has been in the community. And it's a very old standard method for that infectious disease experts and epidemiologists use.
And in terms of old standards, I was fascinated to see the use of plasma donations and plasma in treating patients from people that have gone through the illness and have antibodies. Dates way back to, in fact, was used as a method in the 1918 flu pandemic itself. What is the thinking there? How much do we know about the efficacy of that? I know that there are New York City hospitals already taking blood donations from folks that have been through COVID.
Well, there's a lot of old evidence going back 100 years, but more recently, again, after that first SARS virus infection in 2003, a number of studies were done looking to see if you could transfer the plasma containing the antibodies from recovered patients. What you do is you take out their blood, give them back their red blood cells, extract out the plasma component that has high levels of antibodies, select only the patients that have high levels of antibodies, and then give that as a therapy. And it's been shown in a nice paper a few years after the SARS epidemic in 2003 that it seems to work. And now there's a new study that just came out of China. It's more of an anecdote, around 5 patients, that it seems to be working. So, I have a lot of enthusiasm. A number of my colleagues have a lot of enthusiasm that this could be the first treatment that we have for seriously ill patients, with one catch, and that is you generally have to give that antibody treatment pretty early. If you wait till patients are very sick, in the ICU, it may be too late. So the earlier you can give it, the better. So then it's a matter of, can we scale this up? And a number of us have been on the phone with the Food and Drug Administration. There's a branch called the Center for Biologics Evaluation Research, led by a wonderful guy named Dr. Peter Marks, who's been really on top of this, together with a lot of heads of academic health centers, to build this ecosystem where you can identify patients, take their antibody, and then process it in the transfusion lab, the blood bank lab, and then give it back to individuals. And it's a matter of whether we can do that at scale. It's not easy to mass produce. In time, there will be more commercial therapies available of hyperimmune globulin with containing this antibody. But for now, we think it has some real hope for patients.
Well, that is a hopeful note. Dr. Peter Hotez, always a pleasure. Thank you so much for your time. Really appreciate it.